Hi, my name is Sid. I'm a GP pharmacist based in Kent. I'm going to talk to you about my day that I've had so far. I've just finished my shift now. We had triple the amount of prescription requests, mainly for patients that not only are panicking and overordering medication during the pandemic outbreak, but also the Easter holidays are coming up with Good Friday and Bank Holiday Monday looming. Even though the pharmacies are open for a few years in those days, not all the patients are aware that they are, because they've always been shut before the pandemic crisis. And one of the requests that are often being requested more often than not are the asthma inhalers. Inhalers that patients not have requested for a good few years, either because they've had a chest infection once, or they've not attended their annual asthma reviews with practice nurses. We tend to see a lot of that, as well as a lot of misinformation from social media that not only should they be requesting those inhalers, but also rescue packs, which is a combination of oral antibiotics and steroid tablets, just in case if they had any flare-ups. Also, the government have just published a scheme where patients that are considered at risk or vulnerable, they need to be social isolating for 12 weeks. One of the conditions are if you are severely asthmatic, which is only applied for patients that have been in hospitalization or high dose steroid courses over the last 12 months. And we're getting patients that are not only asking but demanding surgeries to be put on that list, because not maybe because they want to take 12 weeks off from work, or they're panicking because in case if they get any worsening respiratory symptoms, at least they'll be safe at home and be able to self-isolate officially. And when we reject them as a practice, we often get a lot of verbal abuse, not only just for myself but also for my practice admin staff and my GP colleagues. And that does put a lot of pressure onto us, as well as my community pharmacy colleagues, when they are getting more than the requested amount of inhalers, and then they're running out of stock from the wholesalers. Even the alternatives are being out of stock, and there's a lot of pressure goes to them as well.